Picture this. A 68-year-old retired bus driver still bowls every Tuesday, keeps clearing his throat all day, and thinks the problem must be in his throat. Then his doctor says 7 words that change the whole picture. It may not be your throat. Here's what I'll show you today. You wake up, swallow, clear your throat, sip some water, and there it is again. That sticky feeling, that drip, that lump-like sensation. You talk for 10 minutes, and your voice starts sounding rough. You lie down at night, and it gets worse. Or you finish a meal, and suddenly you need to cough. A lot of people over 60 know this pattern. You keep trying to get rid of the mucus, but it feels like it keeps coming back. And after a while, you start asking a fair question. Is this just aging, or is something else going on? Here's the first thing I want you to hear. It's completely reasonable to wonder about this. Most people do. And no, it's not always just age. Sometimes the problem is extra mucus. Sometimes it's normal mucus, moving to the wrong place. Sometimes the mucus is thicker. Sometimes the throat is irritated, so even a small amount feels huge. And sometimes the throat keeps trying to protect itself, over and over. That's why this can feel confusing. Same symptom, different causes. Picture someone in their late 60s, retired school teacher, still does the morning crossword in pen, still walks her small terrier before breakfast. This is a composite of common cases. She says, "I'm not sick. I'm not coughing up much, but I keep feeling something back there." She points to the lower throat. She clears it again. Then again. By noon, her voice sounds tired. By dinner, she's convinced something is stuck. That scenario is common. Very common. I'm Jason Ford. On this channel, I review published research on senior health. What a 15-minute appointment often doesn't have time to explain. Before we get into it, drop 2 things in the comments: your age and the city or state you're watching from. I read every comment on this channel. It really does shape what I cover next. Take 5 seconds, drop it below. I'll wait. Now let's get to the part that matters most. Why this keeps happening and why the real cause is often missed. Your body makes mucus all day. That part is normal. According to ENT Health, reviewed in 2018, your nose and throat normally make about 1 to 2 quarts of mucus a day. That sounds like a lot, because it is. But most of the time, you swallow it without ever noticing. That's the shareable fact. The problem usually isn't that mucus exists. The problem is that you start noticing it. Think of mucus like oil in an engine. You want some. You need some. It protects tissue, traps dust, and helps keep the lining of your nose and throat from drying out. But if it gets too thick, or starts moving the wrong way, or hits irritated tissue, you feel every bit of it. That's when the throat clearing starts. And here's where most people get misled. They focus on the throat, even when the throat is only the messenger. American Family Physician published a review in 2017 saying that most chronic cough in adults comes from 4 main causes: upper airway cough syndrome, reflux, asthma, and non-asthmatic eosinophilic bronchitis. Upper airway cough syndrome is the newer name many clinicians use for what people often call post-nasal drip. That one matters here, a lot, because if mucus is dripping from the nose or sinuses down the back of the throat, you may feel it there all day, even though the source is higher up. Cleveland Clinic, in a 2022 review on post-nasal drip, describes it simply: more mucus than normal gathers, then drips down the back of the throat. That can create a tickle, a need to swallow, a cough, or that constant urge to clear your throat. Harvard Health wrote in 2018 that post-nasal drip can happen for several reasons: allergies, viral infections, sinus infections, irritants in the air, cold, dry weather, and even spicy foods. Their article also says the steady trickle of mucus can irritate the throat and trigger a nagging cough or frequent throat clearing. So that's bucket 1, the nose and sinuses. Bucket 2 is reflux. And this is the one that surprises people. A lot of people think reflux means heartburn, burning in the chest, acid coming up. Easy to spot. But the throat has its own version of this story. A 2024 review in Alimentary Pharmacology and Therapeutics, indexed on PubMed as Diagnosis and Management of Laryngopharyngeal Reflux, explains that laryngopharyngeal reflux can be linked with chronic throat clearing, cough, globus, that lump in the throat feeling, sore throat, hoarseness, and mucus in the throat. That last phrase matters. Mucus in the throat. So yes, you can feel throat mucus, and the driver may be reflux, not a cold, not an infection, and not just getting older. And here's the twist. You may not even feel heartburn. The National Institute on Deafness and Other Communication Disorders, or NIDCD, updated guidance in 2011 saying GERD and laryngopharyngeal reflux can irritate the throat and voice box. Their page also notes that some people with LPR may constantly feel the need to cough to clear the throat, even without classic heartburn. That's why so many people miss it. They say, I don't get acid reflux. But what they mean is, I don't get chest burning. Those are not the same thing. Now bucket 3. Dryness and thickness. ENT Health, reviewed in 2018, says thick secretions often get worse in dry indoor air, and they also note that age itself can be part of the picture. Some medications may thicken mucus. Dry heated rooms can do it. Not drinking enough fluid can do it. Mouth breathing can do it. So can long stretches of talking without sipping water. The mucus may not be dramatically higher in volume. It may just be thicker, stickier, and harder to move. Think of the difference between water and syrup. Both are liquids. One slides, one clings. That's the feeling many people are trying to describe. Now bucket 4, a sensitive throat. This is the part almost nobody explains well. If your throat has been irritated for weeks or months, it can get jumpy. A little mucus feels like a lot. A mild drip feels sharp. A tiny bit of reflux feels huge. Then you clear your throat to get relief. It helps for a second. Then the tissue gets more irritated. Then you clear it again. It becomes a loop. Not because you're doing something wrong, because irritated tissue gets reactive. And if you're thinking, fine, but why does it feel worse at certain times? Good question. Patterns tell the story. If it's worse in the morning, reflux or dry mouth overnight may be part of the picture. If it's worse after meals, reflux again climbs higher on the list. If it's worse during pollen season, in dusty rooms, or when the weather changes, postnasal drip becomes more likely. If it gets worse when the heat or air conditioning is running, thickness and dryness matter more. Pattern first, then cause. That's how you stop guessing. One more point, because this is where the video turns. The 2024 Reflux Review also says there is no perfect gold standard test for every person with these throat symptoms. That means a lot of people bounce from remedy to remedy, because the symptom is real, but the cause isn't always obvious on day one. So if you've tried random cough drops, random sprays, random home fixes, and thought, why is nothing sticking? That may be why. You were treating the sensation, not the source. If this is useful so far, subscribe. I do one of these deep dives every week, and I build them around questions people over 60 keep asking. Now let's talk about what to do with this in a calm, practical way. Here's the good news. You do not need to solve this by guessing harder. You need a cleaner process. Step 1. Figure out your pattern before you chase a treatment. This sounds simple. It works because it turns a vague symptom into clues. Ask yourself 4 things. Is it worse in the morning? Worse after meals? Worse outdoors or during allergy season? Worse in dry rooms or when you talk a lot? Write those down for a week. Short notes. Morning. After dinner. Bedroom. Pollen day. Voice rough. That kind of thing. Why does that help? Because upper airway cough syndrome, reflux, dryness, and swallowing-related irritation do not behave the same way. They leave different fingerprints. If your pattern screams nose and sinus drainage, ask your doctor whether postnasal drip or upper airway cough syndrome fits your situation. If the pattern points to meals or lying down, ask whether reflux or laryngopharyngeal reflux should be considered. If it's mostly dry, sticky, and worse in heated rooms, ask whether dryness, medication effects, or mouth breathing may be driving it. That first step saves time. And number 3 is the one that surprises people, because it involves your environment. But before we get there, step 2 matters more than most people think. Step 2. Make the mucus easier to move, not by attacking it, by thinning it. Harvard Health's 2018 article on postnasal drip mentions hydration, steam, sleeping with the head elevated, and nasal irrigation as common ways to make mucus less irritating. ENT Health, reviewed in 2018, also says many older adults need enough fluid to help thin secretions, and that saline irrigation or saline spray may help thickened mucus pass more easily. Notice the theme: easier movement, not dry everything out. That's where people get it wrong. Some products may give short relief, but if they leave you drier later, the cycle can come back stronger. That's why this is worth discussing with your own doctor, especially if you have heart, kidney, or fluid balance issues, or if you already take several medications. You don't need a perfect routine. You need a steady one. A glass of water near the chair where you sit most. A bedroom that isn't bone dry. Saline strategies your doctor says are safe for you. A little less throat clearing. A little more gentle swallowing. Small moves. Big payoff. And here's a helpful trick. When you feel the urge to clear your throat, try a sip of water, or a deliberate swallow, before you do it again. Not forever. Just as a pattern breaker. If the tissue is irritated, repeated throat clearing can keep scratching the same spot. Now this next one is the one everyone misses. Step 3. Don't rule out reflux just because you don't feel heartburn. This is where a lot of senior viewers have an oh moment. NIDCD's 2011 guidance says reflux can reach the throat and larynx, irritate tissues, and leave you hoarse or constantly trying to clear your throat. The 2024 review in Alimentary Pharmacology and Therapeutics says mucus in the throat, cough, globus, and sore throat can all show up in laryngopharyngeal reflux. So if your symptoms are strongest after meals, when bending over or when lying flat, that's worth a conversation, not a panic. A conversation. Ask your doctor whether your pattern fits reflux and whether your symptoms call for lifestyle changes, medication review, testing, or an ENT or GI evaluation. Do not start, stop, or change acid-reducing medicines on your own based on a video. Talk to your own doctor about what fits your medical history. And if you're thinking, what kind of changes are we talking about? ENT, Health's page on G, ERD, and LPR says adults are often advised to avoid eating close to bedtime, watch problem foods that trigger symptoms, and reduce tobacco and alcohol if those are part of the picture. But again, make that personal. Make it medical. Make it fit your situation. Not every sore throat is reflux. But reflux is more common in this symptom pattern than most people realize. Step 4. Review your triggers and your medication list. This one sounds boring. It isn't. ENT Health's 2018 postnasal drip guidance lists allergies, reflux, age, and medications that thicken mucus as possible contributors. Harvard Health adds irritants in the air, viral illness, sinus issues, cold dry air, and even spicy foods to the list. That means your symptom may not have one cause. It may have 2 or 3. Picture someone else in this situation. A 73-year-old retired accountant, still gardens every weekend, still helps with the grandkids twice a week. This is another composite of common cases. He says the mucus started in winter. Then you learn 3 things. The house heat is running non-stop. He's using strong cleaning sprays in a small bathroom. And he started a new medication a few months earlier. None of those facts alone prove the cause. Together, they give the doctor somewhere real to look. That's the point. Bring your medication list. Bring a timeline. Bring the pattern notes you wrote down. Ask your doctor or pharmacist whether any medicine on your list could be drying your mouth, thickening secretions, or triggering cough. Do not stop a prescribed medicine on your own. Ask what, if anything, should be adjusted. Tell me in the comments which pattern sounds most like you. morning mucus, after meals, all day, or mostly in dry air. I'm curious what you're noticing. Step 5. If it keeps going, get the right evaluation instead of living on guesswork. This is the one almost nobody wants to hear. But it matters. Persistent throat mucus is often benign. Often. But persistent symptoms deserve a real look when they don't improve. Cleveland Clinic's 2022 review says postnasal drip is usually harmless, but if it doesn't clear up within a couple of weeks, or if other symptoms show up, a healthcare provider can help sort out whether something else is going on. NIDCD's 2011 guidance says hoarseness lasting more than 3 weeks, trouble swallowing, trouble breathing, coughing up blood, or a neck lump deserve medical evaluation. That is your line in the sand. Not fear, clarity. And here's the part people remember. The feeling of mucus in your throat does not always mean your body is making far too much mucus. Sometimes it means the mucus is landing on irritated tissue. Sometimes it means it's thicker. Sometimes it means the source is your nose. Sometimes it means the source is your stomach. Same feeling, different road. If you have a parent or a spouse or a friend this applies to, this is worth 60 seconds of their time. Send it to them. Now, I want to answer the question I know is in your head. What if I've had this for years? Here's the honest answer. Long-running symptoms do not automatically mean something dangerous. Research and major clinic guidance point to common causes like postnasal drip, reflux, allergy patterns, dryness, and irritation loops. But long-running symptoms also deserve a proper workup if they are changing, worsening, or paired with red flags. Which brings us to the proof and the limits. Let me name the sources one more time because you deserve to know where this comes from. ENT Health, reviewed in 2018, says the nose and throat normally make 1 to 2 quarts of mucus a day, and it lists postnasal drip causes that include allergies, reflux, age, and medications that thicken mucus. Harvard Health, in 2018, describes postnasal drip as a steady trickle of mucus that can irritate the throat and trigger coughing or throat clearing. Their article also lists common triggers like allergies, sinus problems, irritants, cold, dry air, and spicy foods. American Family Physician, in 2017, says most chronic cough in adults comes from 4 main causes: upper airway cough syndrome, reflux, asthma, and non-asthmatic eosinophilic bronchitis. That matters because chronic throat clearing often overlaps with the same cause map. The 2024 review in Alimentary Pharmacology and Therapeutics, listed on PubMed, says laryngopharyngeal reflux can show up as throat clearing, cough, globus, sore throat, hoarseness, and mucus in the throat. It also says diagnosis is not always simple, which is why symptom pattern matters. And NIDCD, updated in 2011, says reflux can irritate the throat and voice box, and that some people with LPR may feel they constantly need to clear the throat, even without classic heartburn. Now the red flags. There are situations where you should call your doctor today, not next week. Today. If you have trouble swallowing, or food feels like it sticks. If you choke, cough, or feel short of breath when swallowing. If you're coughing up blood. If your voice stays hoarse for more than 3 weeks. If you have a new neck lump. Pain with swallowing. Chest discomfort tied to swallowing. Or unplanned weight loss. Those are outside the scope of a video like this. They need direct evaluation. Johns Hopkins Medicine lists persistent sore throat, hoarseness, chest pain or discomfort, and trouble swallowing as reasons to talk to your doctor in swallowing-related disorders. NIDCD says hoarseness beyond 3 weeks, trouble swallowing, breathing trouble, or coughing up blood deserve medical care. That's your safety floor. And if you're still with me, this next part is why. The symptom is real, but the symptom is not the diagnosis. Let me run through the core points quickly. 1. Mucus in the throat is often a source problem, not a throat problem. 2. The biggest buckets are postnasal drip, reflux, dryness, or thick secretions, and a sensitive, irritated throat. 3. Your pattern matters. Morning after meals, during allergy season, or in dry air. 4. Random remedies help less than a clean conversation with your doctor, based on real clues. 5. Red flags change the picture, and those need direct care. Here's the whole message in one sentence. The feeling of constant mucus in your throat usually makes more sense once you stop asking, "How do I get rid of it?" and start asking, "Where is it coming from, and what is irritating the tissue?" And there's one thing I still haven't told you. It's one reason the next video on dry mouth at night matters so much, because overnight dryness can make this whole symptom feel twice as loud by morning. If this helped you see something new, subscribe. Next week, I'm walking through why you wake up with a dry mouth after 60, and the sleep, breathing, and medication patterns that quietly make it worse. And in the comments, I'd love to hear which pattern sounds most like you: morning mucus, after meals, allergy season, or all day long. Take good care of yourselves. I'll see you next week. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.